Also, during the presentation and the panel discussion, we would ask, please, if you can keep yourself on mute, just so we keep background noise to a minimum. We will have the chat, though. That's up and up there and running. So please, again, if you've got observations, things you want to pose, the chat is your mechanism until we get to the open floor part later on. When we get to questions from the floor, if people feel they want to, we'll release so you can open your mic and you can say who you are and what your kind of question is. If you'd rather pose it in the chat, then by all means do so. So that's our agenda and our housekeeping. Jack, if you wouldn't mind just flipping to the next slide for me. So let me just introduce myself a little bit more formally, and then I'll go to my colleagues. So I work for an organisation called Education Development Trust. If you're not familiar with Education Development Trust, we are an education charity operating both in the UK and internationally. One of our main strands of work is employability and careers. Careers work, including things like National Careers Service, through to work with hubs and schools doing IAG. But in our employability world, we run a couple of branded programs called Making a Difference for adults, and then one working with Neat Young People, Reach Your Potential. And my area of work is I am Deputy Director responsible for our youth or young people's programs. So that's my sort of interest in this area. One of my programs is a NEAT program. If we could go to my next slide, please, Jack. So I'm very grateful to the 4 individuals who have agreed to join me this morning to help dissect and look at what the research is telling us. I'm just going to ask them to, in a minute or two each, just introduce themselves, what their interest in this area is. So I think just for logic, we'll take it in the order that it is on the screen. So Anya, would you mind just introducing yourself?
Yeah, of course. And thank you. So my name's Anya, Anya Ruth, and I work as a senior policy officer in skills and employment at the Greater London Authority. So I mainly work on employment support, and I suppose thinking about how employment support in London is meeting the needs of Londoners and bringing them closer to the job market and to good work. So I currently work on the Mayor's No Wrong Door programme, which is all about integrating and joining up London's skills and employment services. And I'm also involved in the UK Shared Prosperity Fund youth employment strand and shaping how that looks. So yeah, this research is really relevant to the work that I'm involved in at the minute. And yeah, having read the report, I think has some really important findings. So I'm looking forward to having a bit of a wider discussion this morning about what these findings mean for policy and programmes. And yeah, thanks for inviting me.
Brilliant. Thank you, Anya. If we can go, Gary, can you go next?
Sure. Thanks, Mark. And thanks for inviting me along today to take part in this. So Gary Mundy, I'm lead on research and evaluation for Career Connect, and we're a charity providing careers and employability support to young people and people coming out of prison as well. Currently working with over 60,000 young people, mainly across the Northwest, but not exclusively. And because of my particular role around research and evidence, I'm really interested to see the report. I think it's a really valuable contribution to our understanding of the issues, and it cuts across many of the sort of research issues that we're interested in as well, and some of the things that have been publishing and looking to publish over the coming months. So really looking forward to the conversation today. Thank you.
Thanks, Gary. Henry?
Thanks, Mark. I'm Henry Fowkes. I'm the Policy Public Affairs Lead for ERSA. People probably do know who ERSA are on the call, but we're the trade body for the employment support sector, and I'm one of the co-authors of the report itself.
Brilliant. Thanks, Henry. And of course, we're going to hear from Henry in a bit more detail next in a few moments' time. So last but not least, Lucy.
Hi, yeah, so my name's Lucy, Lucy Pennell. I'm 23 years old. I'm here on behalf of the young people that are not in education, employment or training, and just to share my experiences of what it was like for me. Been out of work for almost 3 years, and have recently, with the epic help of the REACH programme, I've been offered a job, an apprenticeship with LabCorp as a laboratory technician, and start in August. So that's very exciting.
Great. Thank you, Lucy. And I mean, really nice to hear your kind of success, you know, having had that adversity of being out of work for a number of years as well. So I hope, colleagues, you'll see we've got a varied panel. We've got that mix between, you know, Anya representing perhaps the London end of things, and Gary talking from a northwest side, and then also that difference between perhaps policy, practice, Henry coming from his research angle, and then of course Lucy actually being able to give us a view as to what does it feel like on the other side of this, and what are some of the things that for all of us as practitioners that we perhaps need to keep in the back of our mind. Of course, though, as we go through this morning, we don't have all the answers. I'm sure amongst the audience that many experienced professionals that will have their hints, tips. So please, you know, do share that as we go along, certainly through the chat, and then when we get to the audience part later on. Right, that is pretty much our introductions done. What I'm going to do now is, if we can go to the next slide, I will then be handing over to Henry, who for the next sort of 15 minutes or so is going to give us the core of saving us all a job in terms of reading the full report, although we'll make that available to you at the end to summarize some of the kind of key findings at this point. So I'm going to hand over to Henry at this point. And yeah, when you're ready, Henry, go for it.
Thanks, Mark. And yeah, thank you for everyone else. And just seeing the question pop up. Yeah, the Ronnie presentation will be shared afterwards. So yeah, Jack, if you just want to flick to the next slide, please. So the research started in autumn 2022. And we wanted to do this because we wanted to better understand the barriers, available types of revision and best practice that ERSA members use when working with neat young people. So we identified that there was lots of existing research out there about how to identify young people at risk of becoming neat. But we wanted to look at what happens when that early intervention fails and reintegration of the older neat cohort is required. We thought it was a very important time to do it, and this won't be news to people on the call, I'm sure, but around the timings of it and the wider sectoral and economic context, the end of European Social Fund and BBO projects, the start of UKSBF, the patchy nature of what that might look like in the future. I think it's becoming clear now that there's going to be a number of places in the UK where there won't be any provision at all for neat young people, which is obviously extremely worrying. And then from a national perspective, youth hubs seem to be kind of the answer to DWP's questions about youth employment, but obviously that doesn't, a lot of them don't cater to those not claiming universal credit, and then the ongoing interest in economic inactivity from policymakers and the like. Jeff, I just want to flip to the next slide, please. So I think, so for some context, I mean, it's important to remember that obviously not all neat people are the same. Each neat young person will have, this is a catch-all term, but each neat young person will have their own set of circumstances and barriers that stops them from entering employment, education or training. But for some context, more than 1 in 10 young people between the ages of 16 and 24 in neat. At the last ONS release, it was estimated at 11.3% of all young people were neat in January to March 2023. And this has been a structurally high, and this has remained structurally high over the past 20 years, with it never falling below 10%. Care experienced young people, 4 times more likely to end up being neat than non-looked after groups, which is a shocking statistic. And the short-term consequences of hit confidence levels and increase risk of living in poverty, and then the long-term consequences of there being a negative association with earnings and health and well-being levels. Next slide, please, Jack. So for the report, we used a number of research methods. We did a literature review of existing research out there about neat young people. We surveyed ERSA members, a total of 131 organisations filled out that survey. And then to combine that, we did qualitative interviews with practitioners themselves and most importantly, qualitative interviews with young people who have lived experience of being neat. Next slide, please. So we wanted to look at the, these are kind of the main things that we wanted to find out. We wanted to find out the barriers, what is currently offered in terms of entry, what is offered in terms of in-work support, and what types of provision are most effective at dealing with these barriers. Next slide, please. So in terms of the barriers, we found there were multiple barriers underpinning why young people are neat, and they intersect. It's not just standalone barriers to stopping somebody from becoming neat. And most of these barriers are not motivational, but instead capability or opportunity related, and often outside young people's control and require structural level solutions. So in the survey, organisations are asked, what are the biggest barriers facing young people on your caseloads for entry into employment, education and training? And they were allowed to select all that applied, and the results to that question are on the next slide, please, Jack. So hopefully you can see that. But yeah, staggering 92% of practitioners selected mental health as a barrier, followed by a lack of confidence at 90%, lack of formal qualifications at 78%, lack of employer understanding 58%, insecure housing 58%. And I'll go into a bit more detail on that on the next slide, please, Jack. So mental health, as I said, chosen by 92% of respondents. We know that mental health, diagnosis of mental health conditions has risen for all young people in the last decade, but this rise has been more sharp or increased more for neat young people in particular. A lack of confidence was selected by 90%, and for care leavers in particular, particularly the ones that we spoke to, this was often due to a lack of a support network around them, which wasn't helped really by changing personal advisors or practitioners that they were supposed to be building trusted relationships with. Lack of formal qualifications. I think we know that poor education outcomes often lead to poor employment outcomes, and care leavers in particular tend to perform worse at GCSE level and in terms of access to higher education. The lack of employer understanding is a massive one. Employers' expectations are often too high, and young people that we spoke to often articulated this through the difficulty to fit into the rigidness of work straight away. Insecure housing, particularly relevant for care leavers, that was selected by 58% of respondents. Care leavers often face housing crises at various transition points in their lives. So the average age for non-care experience young people to leave home is 23, whereas for care leavers in residential care, this happens at 18 or even earlier in some of the for some of the young people that we spoke to. And when they've got their first house to look after, I think their employment ambitions fall down the pecking order a little bit. And lack of financial stability is obviously a hindrance to entering employment, education and training. Particularly training, as often many of the training programs that people could enter do not provide adequate financial remuneration, and are often only suitable to those with a bit of financial safety net around them. For care leavers, it's also important to remember that financial support differs based on which local authority you live in, and with things like apprenticeships, the wages are often too low, particularly for those with families themselves. So next slide, please, Jack. So in terms of the current provision, we wanted to look at how organisations decide what type of support to offer and what is the most common type of support for young people. Next slide, please. So in terms of the top 5 most commonly selected type of support, you can see the information, advice, guidance, 95, and then the top 3 kind of all around information. followed by soft skills training and work experience. Next slide, please, Jack. The 5 least commonly selected types of support: virtual work experience, higher education, conferences, peer mentoring, and internships. And interestingly, mental health support was only selected by 49% of participants, despite it being chosen by 92% of participants as a barrier. So next slide, please, Jack. In terms of in-work support, we wanted to find out what in-work support was offered. So continuation of support to young people, 88%, and this was around checking in with the young person on an ad hoc or regular basis, based on how they're fitting in their new role or on their new course, etc. The financial support often came in the form of uniform or travel allowances. Employer training came in the form of disability or trauma-informed training, and the most common type of the most common time frame for this type of support was around 6 months. So next slide, please, Jack. And then this is just a quote from the practitioner during qualitative interviews. We always provide the opportunity to carry on that relationship. I think it's important because young people can go into employment and 3 months later say it's not for me. Next slide, please, Jack. So overall, in terms of the current provision, employment support organisations often fill the gaps in vulnerable young people's lives, providing the advice, financial support, and checking in that they might not receive in their families. However, there is sometimes a mismatch between what is available to young people and what young people want or need when attempting to move into employment, education, or training. Next slide, please. So finally, what works? This was based on survey responses and qualitative interviews. We allowed practitioners to describe their best their idea around what works, and then we asked young people themselves what they thought worked best for them. So one-to-one support and guidance was favoured by both practitioner and young people, as it puts the young person at the centre. However, this guidance needs to be tailored, non-discriminate, and it's important to try and keep advisors consistent so the young people aren't having to constantly start again with new advisors. Connections with sympathetic employers is obviously very important. The workplace can often become a support network in itself, but for the successful short-term and long-term retention, ensuring there is flexibility in employers' expectations of young people, which may come in the form of a phased start or a trial period with a guaranteed interview, is very important. Mentoring, this was a bit of a mismatch between survey and young people. So only 1 out of 87 responses to that question identified this as a method that they consider best practice. But young people we spoke to, particularly care leavers that we spoke to, indicate this needs to be a priority, as they much prefer getting advice from people with someone with a similar background or characteristics in themselves. And we spoke to a care experience practitioner as well, and that individual expressed how she feels that helped her greatly when working with young people. Bite-sized career and employability support, particularly for those furthest from the labour market. Employment advice interwoven into other activities was a good way of starting their journey into employment educational training without too much pressure from an advisor or the time constraints of a programme. And then the continuation of support is important to ensure long-term retention, but this is often done by providers ad hoc and outside of contract/programme requirements, so it doesn't always happen, but it's very important. And next slide, please. So we've got some recommendations on the report, and this is split into recommendations for policymakers and then recommendations for practitioners themselves. So next slide, please, is the policymaker ones. So we recommend that funding for NEET programmes should include allocations for young people to access private mental health support, such as talking therapies, particularly when waiting lists for NHS mental health programmes remain so long. Evaluate the fees and funding structures of supporters, such as semi-independent accommodation, to ensure they do not act to directly prohibit young people from entering or staying in employment. Review accommodation allocation for care leavers in each local authority. develop a network of corporate employers who can accommodate employing neat young people. All local authorities should consistently provide ring-fenced employment opportunities. And finally, provide fully funded trauma-informed and mental health training for small and medium enterprises. And then for practitioners, next slide, please, Jack. Employment and skills providers who operate in similar geographies should create and share local networks of smaller employers who may not have formalised social value commitments, but are nonetheless sympathetic and open-minded about hiring neat young people. And organisations should employ young people or individuals whose background match the typical caseload to act as consultants in the development design of services or as peer mentors. And next slide, please. Yeah, that's it from me. So thank you for listening. I know we're going to questions now, but I can put I've seen a few questions in the chat, but I can put my email in the chat, and if people want to follow up with me on that, then please do. But yeah, thank you.
Thank you, Henry, for trying to compress, quite a large report into a few slides for us. And I appreciate there's a lot of information in there for colleagues to remember and capture. So I think we said it, Henry said it at the beginning of his presentation, that we will make the full slide deck available to you, as well as obviously the report next. So what my job now with my co-panelists is, I've been rapidly scribbling while Henry's been talking, and I'm trying to find a few questions that I'm going to start the ball rolling with. I know we've got some questions in the chat as well, and I will come to those, but I'm going to, I suppose, take Chair's prerogative to start off with and pose a few questions that I've picked up and try and have some discussion around it, because I think our job now is to try and translate some of what the research is telling us into how does that apply, and what are we seeing in our different spheres. So I suppose my first question is a fairly general question, really, because it's around the barriers that were identified. And early on in the presentation, Henry highlighted a range of barriers, and I'm going to pick up on mental health slightly separately in a moment, because I think that's a whole topic of conversation. But there are lots of barriers that young people who find themselves as neat are facing, and Henry talked about things, whether that be health, housing, finance, in lack of vacancies, a range of things that I'm sure you will all be familiar with as professionals in this area. I want to ask, though, my panel, does that resonate with you? Is that the sort of experience that you're seeing on the ground in your areas, or indeed are there something different? So Gary, could I just start with you and say, how does that link to what you're seeing in your work, your experiences, perhaps particularly from a Northwest context?
Yeah, no, thank you, Mark, and thanks, Henry, for the really great summary. Not easy to boil that down into a few moments, but you did a great job. So I wanted to pick up first of all on something I think that you highlighted at the very outset of the presentation of the findings, where you said that a lot of the barriers were capability and opportunity related rather than motivational, and I'd say that definitely resonates very strongly with what we see. A piece of work we're doing at the moment where we've been looking at seeking, young people's prevalence of seeking behaviour across sort of high neat wards and low neat wards. And what you see there, very interestingly, is that in those in wards with very high levels of neat, young people are no less likely to be seeking good quality provision than in wards with low neat prevalence. So I think that does reinforce that point about capability and particularly opportunity being really key here. There's a few other underlying issues, I guess, that I would draw attention to from the perspective of an organisation that is delivering support that is relevant to a lot of the barriers that you highlighted today. I think the first one is to acknowledge the growing complexity of the young people that are leaving school and have been leaving school over the past few years. And we've had COVID playing into that, but I think COVID's not the only factor, it's definitely one of them. And what we're seeing is that there's an increasing number of young people at 16 coming out of school that requiring more intensive support around careers and employment. So the needs are much more complex than they've been in the past. We're seeing a higher number of young people sort of classified as being, at risk of NEET at that age. And one example from one of the local authorities we work in, I think looking at what those school leaver cohorts look like over the last 4 years, and you see the proportion of young people with SEND young people has risen from about 2%, I think, in 2019 to, I think, 8% when we're looking at the school leaver cohort that came through this year in 2022. So that has real implications for providers of support, and there's a real risk, I think, that that support gets overwhelmed with the amount of support that's needed, and it's not, these are not young people for whom there is a quick fix. This is not just provision of some information or pointing in the right direction. Well, I know we're going to come on to what works a little later, but there is that is long-term support that is needed for those people, long-term relationships. So it's very intensive. So when you see those, what sound like small percentage increases, that actually translates into some really, big pressures on organisations like ourselves, and I'm sure others here, that are responding and providing that support. I think the other thing that was picked up on as well was around provision, and I'd say that's partly about the amount of provision, but it's also provision that is aligned with the needs of the more complex needs of those young people coming through and leaving school. What we see is that provision often has conditionality around it, which makes it less accessible to young people. I know qualifications were picked up in the report, and that's definitely one of the issues there. But there's other things as well. So, sort of conditionality about length of time spent out of work, benefits claiming profile, and so on and so forth. These all affect accessibility of provision. So it's not just the amount of provision, but it's the relevance of it and the extent to which that is aligned with the needs of those young people coming through. So yeah, I mean, so much of what's in there we'd completely endorse and is aligned with our experience. But those are just a few issues that we've picked up on from our work, both in delivery and through some of our research work, that I think is relevant for the discussion today.
Thanks, Gary. I think you highlight, I mean, I've written down a few things there that you sort of highlight to back up what Henry's saying. I mean, there's the interesting point there about capability versus aspiration, which I think is really interesting. Someone's put in the chat as well, and you said the same thing here. The complexity, it's all very well me saying housing's a barrier or qualifications are a barrier, but actually there's often an interlink between these things, and they're complex and can be quite kind of long term. I mean, I'm also interested, and we might, if we get time, wonder whether barriers change over time. I mean, certainly when I was a practitioner some time ago now, some of these barriers are very familiar, but there are newer barriers perhaps kind of coming up for young people. But let me go to, I'm going to pose the same question to Anya, because we've heard from Northwest. What about in London? What are the GLA sort of seeing around this, Anya?
Yeah, and it's interesting because a lot of what we're seeing in London reflects the findings of this research, and also what you just spoke about in the Northwest, Gary. But yeah, I think so. This piece of research feels really relevant to the GLA right now, considering the end of European social funding and the launch of the UK Shared Prosperity Fund. I think, maybe just a bit of context on the background of the UK SPF. So essentially, this is the government launched this in April 2022 to complement the Levelling Up agenda, and it's really replacing a lot of the funding that was there through ESF and BBO. So £38 million is being invested in the People and Skills Investment Priority, and this is aiming to help reduce some of those barriers that people face to employment and support them to move towards EET, employment, education and training outcomes. So in London, this is basically being split into two strands, and one is supporting economically inactive Londoners, and this is being led through the boroughs and through the sub-regional partnerships. But the GLA also included a bespoke intervention in their investment plan to government, and this is to support young Londoners who are NEET, aged 16 to 24, really in response to some of the data that Henry ran through earlier. And this strand is being led by the GLA. So to inform this work and how this funding will be spent, we recently wrapped up a 2-month consultation. ERSA kindly supported us in running this and bringing together kind of a range of different partners and providers to feed into that. And we also spoke to local authorities, schools and colleges, to businesses, to young people themselves, and really consistent themes emerged when it comes to the barriers facing young people. And those themes do reflect a lot of the findings in this report. So I think these are kind of long-standing and systemic issues which are preventing young people from accessing the targeted support that they might need to be able to progress into and then also sustain positive EET outcomes. Something else that we noticed is that there's a lot of provision out there aimed at young people at the minute, and oftentimes this provision struggles to engage and retain young people. So we need to look at how to close that gap and connect the young people who need support with the provision that is available. And in terms of the actual barriers themselves, I mean, housing and mental health, significant barriers that were raised, employer engagement and understanding as well came through really strongly in our consultation. But I think this just highlights the need for a more wraparound, tailored and multi-agency support offer, where from the outset, local authorities, employers, other community, social health, public services are linked up with employment and skills provision. And I think, we spoke a bit about how barriers, I suppose, manifest in different ways for different young people. And I think that's a really important point to bring out in this research. So, for example, I know this is one of the kind of not as high ranking barriers in your research, but a lot of the young people we consulted with said that the cost of transportation to both engage in support, engage in work placements, and actually start a new job was a huge stressor and a barrier. And that manifested in different ways for young people facing different barriers. So for example, for young people with disabilities, travel funds will need to cover taxi journeys. They might be relying on friends and family to give them spins to appointments or to the new work, which might fall through, and they'll need last minute, 20, 30 pounds to cover a taxi journey. And we spoke to young people with experience of the justice system, and they said that knowing that they may have to pay 11, 12 pounds for their day's travel to attend appointments was causing such a stress, even if they knew that was going to be reimbursed later down the line, that stress prevented them from being present and fully engaging with the support that the programme was offering. So I think it's just important to think about how the barriers that we see in research kind of manifest for different groups and how that intersects as well.
Thank you, Anya. You've covered again some different things to Gary there. I mean, I'm sure Shared Prosperity Fund is on many people's minds on the call here in terms of looking at the, opportunities that might give the sector ahead. And you also raise, I'm going to come back to the point about fragmentation a little bit and local and national. And thank you. You've also prompted me. I'm going to ask a question, I think, about employers a bit later on as well, because linking lots of things. And then interesting what you said about transport, actually, because, of course, in some areas and some areas we operate in, perhaps the barrier is a lack of transport, i.e. very poor kind of public transport. But actually, it's worth remembering, even in a place like London, which is probably pretty well connected for transport, actually the barrier is then the cost of the transport for a young person to access that. Now, what I'm interested in here, though, Lucy, is you've heard a little bit about the research here. We've heard from Gary and Anya from a kind of what they see as deliverers or policy. Actually, what I'm interested in is, look, you've been on the front line of this. You faced these. How do the sort of barriers that we've just been talking about resonate with you, Lucy? Does that support sort of your experience or that of your friends, or actually was there something different in your experience?
Well, one of the main ones that did flag up for me was lack of qualifications, and it did actually link in with another barrier, mental health. But unfortunately, because I got quite poorly in my last year of sixth form, I wasn't able to do my exams for my A-levels. So that just meant, I didn't have a step ahead like I felt a lot of my friends had, when they go into the world of work and they just have that to fall back on, because obviously, employers will be curious about your highest form of education and what your grades are. So it was actually interesting to know that others, what was it, 78% said lack of qualifications was a barrier. So it definitely does mean, you know, it can make you think that you're being held back a little bit and you have less options regarding what fields you want to go into. Because I'm quite into medicine and science, and obviously, you know, A levels help with that. So that was interesting. And another one was transport, because I live in Harrogate, and my first job, I worked in York, and I used to take the train there and then a bus. So, you know, every day I was spending close to £10 just to get to work, which, you know, it's, you know, it doesn't sound like that much, but, you know, when you're doing it 5 days a week, you know, it does add up. So that is another one that resonated with me. Yeah.
Thank you. Thanks, Lucy, and thanks for being so honest and sharing your experiences with us. I'll give you a thing to just think about, Lucy, because I'm going to come back to you a little bit later then and say, is there anything that would have helped with those particular, you know, barriers you've just talked about? So I'll give you a few minutes to sort of think on that one. But you're right. I mean, the economics of traveling might not seem much on a day-by-day basis, but I guess often as a young person starting off, you might not be on the highest of wages, so it soon eats in. Let me just pick up then the sort of elephant in the room a little bit that we've touched on, but came out so highly in the research as a barrier. And perhaps if I contrast it to when I was a practitioner, you know, some time ago, maybe it just wasn't talked about so much, maybe it wasn't so well recognized, but that's the mental health barrier. And if I got my scribbles correct, Henry, I think it was 92% of respondents were highlighting that as a barrier.
Yeah.
Now, what my question here is what can employability services do here, given, with all respect, in most cases, they're not health professionals necessarily. You know, there may be an integration with health, but they're not, you know, most employment professionals are exactly that, and that's their sort of sector. So I'm going to start, actually, I'm going to ask you, Henry, whether you've seen anything from a sort of good practice or research, or from an ERSA perspective, that you sort of said, look, that's something that really can make a difference here.
Yeah, no, definitely. I mean, there definitely are pockets of really good practice, whether that's directly in-sourced mental health support. So FedCap won one of ERSA's awards last year, and it was their customer success service, and that they basically provide a 24/7 helpline for participants on the Restart scheme who are struggling with things to call them up. And so that type of thing goes on. Anya also touched on that wraparound support. So there are like smaller organisations, for example, or more local organisations will have that link with mental health charities in and around a locality where they can refer young people onto. So there are definitely good pockets of practice going on, but yeah, as you said, it's limited to what employability services can do, and that's why one of our recommendations is set funding for it in NEET programs.
Thank you, Henry, and obviously giving us an example there of something you've seen. And I think in a moment I'll ask Anya, because she was talking about integration a minute ago of services, if there's anything further there that can be done. But Lucy, can I just go back to you, because I get that, I suppose one of the challenges when I use that label mental health is it could actually cover a range of different things to maybe mean different things to different people. But did you see that as a barrier, you know, maybe with other friends and things that were looking for work? And is there anything that maybe would have helped, you know, you or them in that circumstance?
I mean, yeah, I know for a fact that a few of my friends were affected with a few different mental health issues. just, you know, affected their confidence and their motivation. And I don't think another factor is COVID. I don't think that helped. I think, you know, I think, you know, the isolation of that, and it kind of just it kind of put a bit of a dent in people's social skills for one, and you know, not really interacting with people in person. I think that would have had a bit of a setback for them. And my friends as well, you know, they're quite I can't speak, this isn't me, but my friends are quite extroverted people. So when that hit, a few of them did get quite low, and they just found it quite hard to actually have the motivation to work, especially with, you know, like, this is slightly off topic, but I was talking with my mum, who she was saying how she has been paid the same amount for almost 20 years, but the cost of housing has increased, basically tripled. So it's like, for our generation, you can kind of see that there is a bit of a lack of motivation, because it's like, oh, you know, how are we going to be able to afford housing when, you know, the rate of pay has stayed the same, but housing has increased, you know? So it's just little things like that where it's actually, you know, it does weigh on your mind a bit, because you just feel like, you know, that's already a setback in itself. So, I mean, all my friends at the moment that do live away from home, they live with roommates so that they can afford to live away from home. And you know, there's minimum wage as well. So, and that is just a factor in of itself. But mental health does spider web itself into it, because, you know, so that's just my experience.
No, thank you, Lucy. Interesting what you say there. You know, a lot of your friends, and quite naturally at the age you are now, are, you know, starting to live away from home and things like that. But, and a really interesting comment in the chat about the role perhaps of parents, and is there a better relationship with parents, you know, now to help sort of support this process. I'm afraid I'm not doing a great job of looking at the chat. I will go back to the chat a bit later on. Can I just ask you, Anya, very briefly, perhaps, if going back to your point about integration, and I suppose where we started this bit of the conversation, that we recognise that probably need professional support services to support this area in terms of mental health. How does that look like, do you think, from a joining of services together?
Yeah, I think that the question of integrating and better connecting services is really intrinsically linked to the barriers that are faced by young people attempting to access skills and employment provision. So I suppose if we're thinking specifically about mental health, I mean, in my work, this isn't a problem that's even unique to young people. We have feedback from a range of partners, including Job Centre Plus, that a lot of customers using employment and skills services are presenting with mental health issues, and practitioners aren't equipped to support them. You know, as been mentioned, there's referrals into NHS talking therapies, into community mental health support services, for example, Mind. These often have very long waiting lists and difficult to access. So I think it's important to kind of trial new approaches to linking up health and skills and employment provision. For example, I know my colleague recently ran a webinar last week, and that's kind of trying to start a new community of practice around linking NHS social prescribing with employment and skills expertise, and building community champions. And then another kind of suggestion that I've heard recently is, employment providers offering in-house counselling services, which obviously need to be funded because they are expensive to run. But yeah, I would say that I think a local response is needed. You know, there's considerable geographic variation in skills attainment in London, and there's, you know, very stark inequalities between different local boroughs. So I think provision should be joined up with local kind of existing community support, local authority services, including healthcare providers. One thing that's maybe relevant is the No Wrong Door programme that the GLA runs. And so this is run sub-regionally, and it is integrating skills and employment provision at a sub-regional level, and is working closely with the boroughs to kind of better join up the way the system works, so that residents are able to access the support that they need, and whether that's housing support, mental health, you know, a more specific type of employability or skills or training. And then this, I suppose, will address the barriers that residents are facing. But I think we do also share learnings from that programme at a London level as well. But I think maybe where we hit a stumbling block is, are we seizing the opportunity to share learnings nationally,
Well,
to
yeah.
understand where something in one region will be successful when it's applied in another region. I think that there's work underway to kind of build these communication pathways at a national level, and definitely events like this help us to do that. But I think there's a lot more to be done there. But yeah, I think we need a local approach to employment provision, but it needs to be balanced with national priorities as well.
Yeah, I mean, that's, I think, a really interesting point actually there, is that what you're saying, I think, is, local works, local needs to meet the needs of the local community. I mean, even if you took London, borough to borough, ward to ward, probably quite different. But actually, one thing that's interesting to me is that NEAT doesn't really have a kind of national framework or national approach in perhaps the same way as if I looked at some of my other areas of work, if I looked at, adult careers or even careers in schools, although it might be delivered in different ways, there may be sort of frameworks to work for. And I suppose that's an interesting question here, really, is each local authority has the statutory responsibility for NEAT. We know on the Shared Prosperity Fund that you were talking about earlier, that's devolution. It's, again, locally based. How do we, or is there a gap there? How do we shape that balance between what you're talking about, local and national? So I mean, Gary, you might have a different view to that. I don't know. What's your sort of view on that local versus national perspective?
Thank you, Matt. I don't think I do have a different view. I think first and foremost, I think I would agree with what others have said, that first, local authorities need to be empowered and funded to respond to local. They have that better understanding of what those local challenges are. They carry that statutory responsibility for youth and needs. And so they should be equipped with the tools to address that. And they should really be seeing that as a sort of longer term strategic issue rather than just sort of quick fixes around, bringing your numbers down. So I think that's very important. I guess the slight concern, which you've picked up on already, is the extent to which good practice is really just staying local. And what we see is there's a lot of variation in approaches across local authorities. And that's great when that variation is really, because you are addressing something that is very specific to that locality. But it's not clear to me that that's always the case. And I think my sense is that some of that is just that variance is just coming from not enough sort of sharing of information about what is working in other localities. And I don't mean by that just taking, a program, a delivery model and just wholesale plonking it over from one place to another. I'm pretty sure that won't go well. But learning about the components of provision that seem to be working across very different contexts, that for me is important. And at the moment, there doesn't seem to be enough opportunities for those kinds of discussions to take place. As Anna said, it's great today we're sort of getting into some of that, but I wonder how often does that happen enough? And I guess thinking about UK SPF funding and reflecting, I guess, on ESF funding before that, I've seen some really strong evaluations of approaches with ESF funding. But there's that question in my mind is, well, where is that going? Is that being shared at the right levels? Are we extracting the learning from that to support good practice being scaled? And is it being communicated in a way that is going to be easily understandable by commissioners and designers of youth employability programs? I just finally, I saw yesterday the Youth Futures Foundation, I don't know if there's anybody here from Youth Futures, but released their youth employment toolkit. And that's a great addition, looking at different approaches and the strength of the evidence around different approaches. But it's like the mechanism for getting that learning out to the sort of commissioners and designers and delivery organizations like ourselves, of course, is going to be really important. So it's great that it's happening, but how do you actually get it in front of them, to the right places at the right time to ensure that it's really informing what delivery looks like?
Yeah, I think I will just say, sorry to jump in, Mark, but
of course, no, go for it, Henry.
I think it's really important to tailor it to a local need, but have that national framework. I mean, in the research for this, you saw the differences between outcomes for care leavers, for example, between local authorities, or outcomes for young neat people between local authorities is like, well, just makes you speechless, really. Hence I can't find the word to say. But yeah, like in Middlesbrough, for example, I think it's 78% of care leavers end up neat, whereas in Cornwall, which is an area of really good practice, it's 20% or 15, between 10 and 15, which is much more like the non-care experience neat rates. So there needs to be a national framework, I think, for local authorities to adhere to, or else, yeah, it does just risk having a postcode lottery, and young people will miss out on a good level of support depending on where they were born. Yeah.
And ultimately, that's a really interesting point around the fact that, I mean, we're not just talking about young people here, we're talking about people in general. People don't stay in the confines of one geographical area, do they? And I mean, I'm sure, Anya, in London, you know, the movement of people across the capital is obviously extensive. But even in any, I mean, you know, take the wider Manchester metropolitan sort of area, I mean, it's going to occur. So that's, I guess, another reason for it making some sense to try and join things up. And great to mention some of our other colleagues. We've got youth in employment toolkits being posted there on the chat, which is really helpful, because I guess in the absence of any national framework, it's down to all of us to try and find ways to cut through and share practice. I'm going to ask a couple more questions, and I'm going to see if people want to pose things from the audience. And I think I'm just going to change tack a little bit, because we've been talking about some of the challenges, some of the barriers. I just want to change tack a bit to maybe what are some of the solutions. And Lucy, I asked you earlier just to have a think about, from your experience, one of the things that comes out in this report is quite logically, perhaps, the young people having a voice in the services that they receive is a good thing. Probably we'd all sort of resonate with that and say that's a logical thing.
Yeah.
We also saw that one-to-one support was still the most prevalent mechanism for activity to occur. And Lucy, you talked about in COVID the challenges of basically not seeing people and not being able to talk to people. And I noticed in the chat as well, someone put in a minute ago about mentoring and that sort of concept of being able to talk to people. I suppose, Lucy, my question after my long ramble there was what worked for you, and are there other things that you think we can all learn from in terms of, you know, more support or other areas of interaction that might have been beneficial?
Well, since working with Reach and with Cassia, who I was working with one-to-one, who was supporting me in finding a job, she was the one to honestly give me confidence, because I have Asperger's syndrome, you know, it's under the autism umbrella, and she was the one to tell me to embrace it. And because of that, I mean, it was definitely one of the reasons I got an apprenticeship, because it was it gave me confidence. The one-to-one that we had, you know, you kind of build up a rapport and a bit of a relationship, and they try to get to know you. That's how I felt anyway. She tried to get to know me as a whole, and got to know my interests, and, you know, just the feeling that I was listened was just enough to feel like my voice was valid, especially, you know, when I was fairly new to the world of work anyway. So, you know, when it's just a bit daunting when you go to a, you know, when you're a young person and it's your first ever job and you don't really know how to, you know, be all professional like the adults that work around you. So with Reach, the fact that it was one-to-one and it was regular, so I think it was, you know, at first it was just about half an hour every week, and then it kind of spaced out to 2 weeks, one appointment every 2 weeks. And just that was enough, because just knowing that somebody was watching you, you know, being there, always kind of there that you need to get in contact with if you need, just something like that, where you know you'll be listened to with where you want to go in for what area of work you're interested in, and just hearing what they have to say, because they provide amazing support, like National Career Service and job fairs, and they'd send on, Cassie would send me emails of job applications that she thought I'd be interested in. So it was, you know, it was a constant relationship where she would provide information for you, and you know, she'd listen, and that was just enough, honestly. I mean, one-to-one is by far, for me anyway, the most effective way of making you feel heard. And yeah.
Thank you again, a really valuable insights. Lucy, can I just ask a follow-up question to that? I guess because in some ways what you're saying to me is the support that you had worked for you, particularly that one-to-one support and things like that. How easy was it for you to find that support in the first place? Because I guess I'm listening to Anya earlier on about it is one of the challenges, I think, in our world is that there's lots of services out there, but do people know how to access them and when to access them? How how did you find out about Reach, or is it a I don't know, is it easy to find these things, or what's your experience there?
In all honesty, I wasn't aware of it until I went to the job centre in Harrogate, and it got brought up to me by my work coach, and I was like, oh yeah, and they'd ask me, you know, would you be interested in doing that? And I was yeah, why not? Because had no idea what it involved. I didn't know that they'd actually provide you any extra support. I thought it was more just, you know, to tell you, you know, send you a few spam emails, you know, but it was in the dark for me, I won't lie, but that's only because while I was in work and then I was out of work and then I went to the job centre, I had no idea how I would go about anything like that. I went to Travai first, but it turned out that the Reach programme was actually just more fitting to me, because it's actually one-to-one, whereas Travai was, I think they'd choose when they'd talk to you. So it was like they'd call you if they found something, but it could be, you know, 4 weeks after they spoke to you last. So it was in the dark, and it was a bit quiet and hush hush for me. But once I was aware of it, it did, you know, overtake my life in a good way, because you know, I used it to incorporate into finding a job, obviously, and it was incredibly effective. And yeah, it was a little bit difficult, in all honesty, to
Lucy,
know about it outside. Yeah.
That wasn't a sort of trick question in terms of trying to get you to say, oh, it was easy to find, because my perception, I guess, would be, you know, I think our sector generally can be hard if you've not had experience of it to know where to turn. And I think what you said there, the job centre or DWP are obviously the gatekeeper in many ways still for our kind of services and accessing. Now I'm going to ask one more question, then I'm going to open it up to the floor. So if you've got burning questions on the floor, now's your time to kind of think about if you want to kind of come on and ask it. But I'm just going to go, because it was something, I think it was Gary who said to me earlier, was talking about employers when we're talking about barriers. And it's not something we've particularly unpicked. And while I think it would be very unfair to say that employers are obviously the core barrier. Obviously, they have a role to play because their understanding of the complexities that we've heard that Lucy and others have faced, and also it's about having the right opportunities at the right level and the vacancies. Anya, in London, I mean, perhaps you could just comment on anything you're doing to try and join up that key player here, employers, to support this agenda?
Yeah, absolutely. And I probably have a lot to say on this topic.
Okay.
I've been speaking to businesses recently and doing some thinking about how we can, I don't know, make it easier for those opportunities to be connected with employment and skills provision. Like, I've heard about some incredible programs that work with young people with care experience. They don't have relationships with employers, therefore it's really difficult to achieve those employment outcomes at the end of the program. But yeah, I think so. Some of the key learnings that have come out from me in my recent conversations. First of all, I think there's a risk that businesses underestimate the wraparound support that can be needed for young people with complex needs during a work placement, work experience, or a job. Often a young person might need pastoral support to both prepare for, but then succeed in the opportunity. And business representatives have told us, like, there's a huge appetite amongst employers in the business community to do more. They don't know what to do. They don't know how to get involved, and they want support to do it, and particularly from specialist youth organisations that are experienced in supporting young people who are NEET or young people who have SEND or have care experience. I think there's a bit of a mismatch in that sometimes employers expect new employees to be ready for work, and they haven't planned to provide that pastoral care. So I think one thing that is important is that expectations and responsibilities are clear on both sides of the partnership in terms of what's expected of an employer, what support they expect to receive from a specialist organisation. And I also think that there should just be greater education for employers on the benefits of engaging with and hiring young people from disadvantaged backgrounds. There's lots of positive case studies. There's a really good business case. We can frame the conversation as a really positive intervention, and also provide incentives to do that. So, I mean, I don't think that all of these interventions are necessarily being done in a great way currently, but there is appetite to change the way things are done. And I think one thing that we're looking at doing with UKSPF at the minute is mapping out the wider kind of system specific employment pathways and the different range of stakeholders that are involved in a young person's journey. So this could be providers, voluntary community sector organisations, employers, understanding how and when to engage young people further from the labour market and understanding the roles that each of those stakeholders plays. Because I think there needs to be genuine collaboration and partnership between them. And yeah, we've at the GLA we've seen some success in better linking up employers and providers from the outset, such as through the Workplace Integration Network and the Mayor's Skills Academy programs, and also some work that we're doing now through the Local Skills Improvement Plan. I'm not going to explain what all of those things are, but I can drop some links in the chat afterwards, just in the interest of time. But yeah, I think it's a really integral part of the conversation, and I think definitely more can be done.
Thank you. I mean, as you say, they are probably a vital kind of cog in terms of the solution here. I mean, one thing that does strike me, though, is it's how we make that streamlined for employers, given the range of pulls, both from an education and a kind of neat perspective. And indeed, it goes back to our debate, I think, about local versus national in terms of how do you do that on a bigger scale. So I don't know, you're working with a large employer that can also support in another region and things like that. That brings us back to that debate. Henry, I'm going to give you the last word on this from the main bit of panel discussion, because I'm then keen to go to the floor. Is there anything just on that topic of employers that you've seen from sort of your research or your view from ERSA that's worked particularly well in this area?
Yeah, I mean, there's some great examples of employer engagement that goes on in the sector. ERSA have an employer engagement forum where employer engagement professionals come every couple of months and share best practice, and if they work in similar localities, share contacts and things like that. So that definitely happens. But as Anya touched on, it's done on an ad hoc basis. It's mainly built on door knocking to employers. And I think the key is to engage employers and service users or participants at the outset of program design, because employers at the end of the day are the end users of the program. So for them to better understand the people the young people on the programs, or old people, depending on the type of program. Engaging employers as early on, helping them in the program design, so they're aware of it, I think is really important. There's also a really interesting bit of research just come out from the Manchester Metropolitan University about the relationship between employers and universal credit, and that found that a lot of employers were very critical of universal credit and the way that that work first approach in a job centre, because employers were having to basically look through hundreds of applications from people who weren't interested in the role but were just forced to apply because of the job centre model of ABC, or because their work coaches told them to apply, or they risk losing their benefits. So yeah, that model obviously isn't an effective way at the moment for people trying to get into work, and then the employers themselves. So yeah, as I said, good practice, but on an ad hoc basis. But for future, I'd suggest that employers and service users are involved from the outset of program design and creation.
Yeah, I think that's something that comes across quite key in both the research and what we've heard from, Lucy today, and probably others about that influence of key service users on the design and implementation of programs. Okay, now I can obviously keep posing questions for forever, but what I would like to do is just see if any of you out there, we've still got nearly 70 people on the call. I know we've lost a few who've had to go off to meetings. In the last 10 minutes or so, is there anybody who wants to come on to the mic, the camera, if you're feeling brave, and pose a question to the panel, or maybe share some really great practice that you want to make a point on? I'm going to kind of hesitate for a moment, so maybe if anybody wants to put their hand up and come on the screen. Oh, have we got somebody putting their hands up? Now, of course, this is where my failing is, because I have to switch from one screen to the next screen to see who it is. Now, apologies. Is it Funby, or I'm sorry if I've said that wrong, but please introduce yourself and what's the question?
Yeah, you got it exactly right. It's Funbi. I'm Funbi. I'm from Speakers for Schools, which is a youth social mobility charity. I mean, organized work experience placements, right? And I think my question is, a lot of times we find employers who actually want to provide opportunities to young people facing the most disadvantaged, but we go through educators, and sometimes the young people we're actually trying to get to meet the employers are the least likely to hear about it because they don't have the pushy parents, and sometimes the teachers actually don't expect, they're not really pushing them forward. So I think my question will be for Lucy about talking to young people in schools. How do you think will be the best way to make sure that those young people are hearing about those opportunities and actually able to put themselves forward for it?
I think if the employers are just open to the diversity of people, because I mean, me and my friends, every single one of us are different, and each of us need different type of support. Like for me, for example, I can get overstimulated very quickly, and the job that I've just been offered at LabCorp, they've already made me aware that I can use a private room if I want to, if I need just to get time away. And, I think if they were to advertise the support to young people more, I think it could just encourage them a little bit to feel, like they're more comfortable in applying for whatever that work is. So I think that would be my stance on it. And just, having employers that are open, are willing to have safe and private discussions with you if needed, if they spot your mental health declining, or if, they notice that your work is, you're not producing the same amount that you did, maybe a month ago, So I think the opportunities that employers could do is just I think just be accepting at the end of the day, really.
Thank you, Lucy.
Yeah, and so I mean, thank you, Fumbi, for coming on, being brave to be the first one to put your hand up. I know we've got Basil waiting. I'll come to you in just a moment. Lucy, that makes me think of another thing we've not really discussed today in great depth, but I think in answering the question there, you talked about two different things. You talked about actually when employers are going to schools, really sort of stressing their willingness around diversity and accepting everybody in different needs, make it feel appealing to different group young people. But then I think you also touch on the fact that there is a piece of work once someone is in employment about employers knowing and understanding the challenges you might have, so that they inadvertently don't make things more difficult for you and kind of lose you in that first bit of employment, which is such a critical point. As you said, you know, a young person, when you start work, it's your first experience. Well, what are the expectations? And so there's a bit there about employers understanding that. Gary, I'm just before we go to Basil, just perhaps from a practice perspective, and you know, as Career Connect, where you're operating neat programs, Fumbi's question about it's easy to get into schools and it's easy to talk to the, you know, perhaps your, dare I say it, your standard sort of academic student, but how do you reach those for employers who might be on the cusp of attending schools, in and out? You know, what is there any sort of tricks? Because Career Connect work across both that education and that neat landscape.
Yeah, no, it's a good question. And I mean, one of the things we've been looked at recently is around sort of increasing numbers of people who are having education outside of school.
Yes.
And at the moment, there is a pretty much complete absence of sort of careers and IAG provision for those young people. So we would definitely share that view that there is high levels of need for whatever, you know, those provisions and programs that are there to be extended to young people that are outside of mainstream provision. You know, easier when the mainstream provision, outside of mainstream provision, but in sort of alternative, what's we think of as alternative provision within the sort of still within the system. But you've got increasing numbers of young people who are completely off of the grid, and their needs are as high, if not higher, than the young people that you're reaching through school-based provision. So, yeah, huge need. Lots more I could say about that, but yeah, and I guess the other thing, I mean, just linking back to some of the previous conversations as well about work experience. We know from our own youth consultation work that work experience and work placements is one of the highest valued things that young people have, but often, you know, a lot tell us that it's just not available, or it's not available in the sort of volume that you know, the supply doesn't meet the demand. So it's very interesting to hear from sort of that perspective about, well, employers are offering these things, and it just feels that maybe that information isn't always, you know, it's not coordinated in quite the right way. So some kind of brokerage between employers and young people, including those outside of mainstream provision, better brokerage, stronger brokerage to link those opportunities up. So it does feel to me like there's just a bit sort of too fragmented there, and that the opportunities aren't reaching the right people at the right times.
Thanks, Gary. Gosh, I could now spin off to a whole bit about work experience there,
yeah,
but I won't because Basil's been very patiently waiting in the wings. Do you want to come on and give us your question?
Can you hear me?
Yeah, we can.
Okay, my story. As a child, I had assessments, and then they said my coordination was bad, and then they told me I had dyspraxia. I got a degree in 1990, age 20, postgrad diploma next year. And then I was told I had dyspraxia, having speech therapy, age 23. You can't get diagnosed with dyspraxia as an adult, I thought people had Asperger's syndrome like Lucy. I was having Asperger's traits 19 years ago. One GP would not allow me to have an assessment. I learned about dyspraxia. I was diagnosed with dyspraxia privately, May 2012, age 33. I also had generalized anxiety disorder about spring 2014. I had a nervous breakdown to my ADHD detected. I was diagnosed in Birmingham, August 2020, age 41. You know, a lot of it was a long time on the NHS to get it diagnosed. A lot of people don't know they have these conditions, these This is a problem, yes. They can have one or more conditions, yes. And maybe to get it diagnosed, understand the complex problems they might have, because system failed me from childhood, you see, you know. The barriers can be complex. Just to have a degree, it's been very hard, you see what I mean, yes. My family can't support them. These things are not very complex, you know. How do we support these people?
Sorry, Basil. Sorry, carry on.
I'm going to say these things can be very complicated, you see what I mean, yes, you know. Regarding mental health, it's a very complex situation for some people, you see what I mean.
Yeah. I think you raised some great points there that ultimately, firstly, I said it, I think earlier when I mentioned mental health, I mean, that's a bit of a catch-all. It could include a number of kind of conditions underneath that. And I think you're right. There's a bit of a challenge there that if things are not diagnosed, you know, early from a school stage, actually young people fall into being neat or have those challenges. And have they got the support networks around those? So I think you raised some interesting points. I don't know if anyone on the panel feels they want to sort of talk about how you link, I suppose, I mean, early diagnosis is an important fact, but how you link that diagnosis that someone might have from a school age, and I know in Basil's case that wasn't the case, but how you make sure that that young person is then supported when they leave school, facing these kind of barriers, and then even beyond that into their adult life, because we do in our world, we tend to silo a little bit that work goes on in schools, work goes on in NEET, work goes on with adults. I mean, Anya, is there any thoughts about how do you bridge those gaps between those different transition points?
Yeah, it's a really important point, and thanks for sharing your experiences, Basil. So I think in terms of young people leaving school, suddenly being expected to be in kind of the adult world, we heard that feedback from young people a lot, that that's really challenging and has an impact on their mental health, particularly when they are dealing with disabilities, learning difficulties, neurodiversity. And I think there's probably goes back to this multi-agency approach as well, just having schools, local authorities, PAs working together better, working with kind of the support providers. So then that young person doesn't have to self-advocate and tell their story at every single time they enter the system again. And then I also think there's probably something relevant around improved training and awareness for practitioners, for education professionals, and for employers around supporting, understanding and supporting people who do have special educational needs and disabilities.
Thank you. Thank you. And thanks, Basil.
Can I say one quick point? Yeah,
of course you can.
I thought having when I was diagnosed with Asperger's traits, I didn't get any support. You saw, I mean, the people who have full Asperger's still get the support. I didn't understand the impact of having dyspraxia, and I couldn't have my ADHD detected. You saw, I mean, yes, the support was not available, and I thought that there was a program in London that could help me. They can't. There's multiple barriers in the way. And then the charities that work for the neurodiverse condition tends to operate in silos.
Yeah, I think, you know, your point there, and it's been said several times, I think, on the panel, is the real key here is to try and integrate things in together rather than, you know, perhaps a traditional approach of things into silos.
Yeah, sorry, just
sorry.
You go ahead, Lucy.
Go on, Lucy. You go first, and then I will probably have to bring us to an end, I'm afraid, because we're running out of time. So Lucy, go for it.
Yeah, I'll be speedy. It was just so yeah, I was diagnosed in 2010, so I was 11 years old. And it wasn't actually until recently, Basil, that I told people I had it. It was just a few months ago that I told my friends, and the first job that I had, where I was working with the NHS in York, I didn't tell my employers, and because I thought it was a barrier of itself, and you know, it turned out not telling them was the barrier. And I'll always look back and regret not telling them, because as soon as your employer understands you, you know, you can trust them. They're not going to judge you in a negative way. They're not going to be like, oh, why did we hire this person? That's just not going to happen. So I think if you say you didn't get there wasn't any support for you, I mean, I think it honestly just helps with telling your employer. It could be a line manager, it could just be someone that you're comfortable with talking to, that you work with, just someone like that, just to tell them. They'll most likely support you. They will most likely try and help you out if you're struggling on a day that could be hard or overstimulating, or you just, you know, not feeling yourself. So yeah, honestly, just tell your employer. There's nothing to be scared about. I thought I was for a bit, but don't be. Embrace it. Use it in your work, you know, use it as an interest, you know, because with my Asperger's, I latch on to very specific topics, and for a couple of weeks I assess it very deeply, and then I'll drop that interest and I'll move on to something else. And I don't know if you'll probably be different, everyone is, but honestly, use it for your work. Don't feel like because you haven't got any support now that you won't get any in the future if you tell someone. So that's just my experience. I regret not telling my past employers in my old job, you know, because, you know, just embrace it is what I have to say, really, you know, especially in a workplace.
Thanks, Lucy, and thanks, Basil, for sharing. And I noticed that Anya's put something in as well about how we join up that school to post-school kind of provision on things. Right, I'm afraid we are nearly out of time. So I know we could take more questions. I know the panel would have more things to say if I let them, but I'm afraid we're going to have to start to kind of sum up. Jack, if you wouldn't mind just going to the last slide. So firstly, a huge thanks to the audience for sticking with us. Those of you that are here to the bitter end. I know we lost a few, but actually we've kept the majority of you for the whole time. So that hopefully means we had something to say that was of interest. Obviously, huge thanks to my panelists, all of you kind of put on the spot and answering it so well. I guess particular thanks to Lucy. As you said, Lucy, as a young person first experiencing some of this world, you did amazing, and we're all very pleased to have you here. Also, a little shout out to those of you that are in the background on this call. So Jack, Julie and Graham, who I know have been putting this together in the background, but we haven't seen you on screen, so thanks to you. What I will say is I think Jack or someone is going to put the link to the full research piece into the chat. But what we do intend to do is email out to all participants the slides, and we'll make sure that you've got the link to the full research. There we go. I've seen it drop in. Also available on our respective websites. So I think for me, if I just leave some thoughts, I mean, I've been scribbling down things as we've been talking through. We've covered a lot of ground, from the barriers and perhaps some of those, you know, barriers that are more prevalent now post-COVID around mental health, and Basil kind of finishing us off there about those challenges on supporting those individuals with SEMD. I think we talked about that balance between local and national, and the need, and all of you on the call have a role to play here in joining things together and sharing practice. Some interesting questions about how we market the service to ensure young people can access, and the point really well made about the need to integrate services, whether that's employers, mental health, mentors, different specialist agencies. Hopefully you can take something away for your practice, and perhaps if you are a designer or a commissioner of service, having a look at the research to some of those recommendations that will help take this area forward for us. So we're pretty much at time. We are going to finish there. Thank you again, colleagues, and everybody that's taken part this morning. Or, yep, still this morning. Yeah. Okay. Thank you all.
Thanks, Mark.
Thank you. Thank you.
Thanks a million, everyone. Take care.
Thanks, everyone.